Again, back with the Miami Business Show. And I'm excited because today, again, we're at Community Newspapers, which has this amazing location in South Miami, studios galore. I'm sure you've seen many of their shows, and I'm fortunate enough to be able to host one of them that is focused entirely on business in Miami. And today we're very lucky because we have Lauren Bodden from Lincoln Health Supply, and I want her to explain what Lincoln Health Supply is. Tell me a little bit about the company.
Well, thank you for having me. Yes, I am the director of marketing at Lincoln Health Supply, and we have been around since 2019, and we've been helping supply those living with diabetes across the country for and since 2019, and we are based in Las Olas, Fort Lauderdale, Florida, but we do have 4 other offices, and we are hoping to provide more of these continuous glucose monitors to those who may not be aware of an alternative way to monitor your blood sugar. And we really want to be there step by step, every step of the way for these people in the community and across the country.
Now, here's an interesting twist. I'm actually a diabetic.
Oh, really?
Yes, I had diabetes too, and now I've been diagnosed with one. So I've been living with these monitors for some time. And I know a lot about them, but I want you to help us understand because probably a lot of people are not familiar with it. What is a glucose monitor? What is that?
That's correct. So rather than having them prick their fingers multiple times a day, every single day, which can be extremely painful and cumbersome, we are able to ship their orders of the continuous glucose monitor directly to their door. So the sensors, they are placed above in the back of the upper arm.
Which is around here, correct?
Yes, around here.
That's where I put
That seems to be the preferred placement. But what they do is all they have to do is take their monitor or their cell phone and scan the sensor to track their blood sugar levels. So it tracks it in real time, and it gives them alerts whether their levels are high or too low. This can really allow them to regulate their diet and live healthier and happier lives without all of that nuisance that they find in their daily routines.
Yeah, I think what's exciting about this product, and I was very excited because my dad had diabetes and he had to use the finger prick method, and then I tried it at first, and it was like taking this little piece of paper and putting it on blood, and then you got to put that in the machine, and if you don't do it right, you got to do it again. So potentially you could be pricking yourself more than one time, and it was really something that that was a barrier for me to do it. And when I found out about these monitors, my life changed because I could put this on, and I could, and it's, for me, it was a little, it looked like a pen, basically, and then you would stick it on there because it comes with glue. But now what's better is that it's a small circle. Is that right?
It is. It's a small circle. We offer the Freestyle Libre, which is that circle that you've seen in a bunch of ads. It's very, the adhesive that it sticks to, it allows it to not fall off.
Yeah,
but in the case that anyone is worried that their sensor may fall off, we do offer what's called safe tape, which is a medical grade adhesive that is placed over top of the sensor for an added layer of protection. It's easy on the skin. And these are very beneficial for a lot of our patients, and they continue asking for more, which is a good thing.
Which is a good thing. And I think what's great, I can tell you from experience, these things do not fall off. I mean, it's an unusual situation if they do, and if they do, it's very easy to put another one on.
Right.
And actually the system is 2 things. It's the monitor, which is a little wheel that you stick to your arm, and then also there's a sensor that is separate. Is that right?
Correct. The sensor is actually what you place on your arm, and the monitor is what tracks your blood sugar levels once that's applied on your skin. And this is something that no one really has to worry about once it's on their arm or on their upper thigh or on their belly, whatever they decide. It does make living with diabetes much easier. And the good thing is that instead of having to prick your fingers multiple times a day, this monitor or this sensor is applied and stays on your skin for about 14 days. The Freestyle Libre. The Dexcom is every 10 days. You have to replace it. And Lincoln Health Supply is really working diligently to supply 2 sensors of the Freestyle Libre every 28 days and 3 sensors of the Dexcom every 30 days. So really depends on what system they prefer, and we deliver it directly to their doorstep.
And you had explained to me how it works. In fact, I'm going to fill this out as soon as we're done here. You, the patient, the person who is diabetic, will fill out this information and then engage with the company, and then the company determines whether their insurance covers it, and then you start getting this delivery instead of having to go to the pharmacy. Is that right?
Correct. It's my favorite part of Lincoln Health Supply. It provides so much ease for diabetics. So really what we do is we've created a logistical network so that everyone who is in need of a CGM has the ability to obtain one as long as they're eligible through your insurance, just like you said. And how we do this is if someone is interested in obtaining a CGM, they can either call us, or we have a survey that they have to fill out, a 2-minute survey, which automatically checks and verifies whether they're eligible through their insurance to see if their insurance does cover it. If in the case that they do have coverage from their insurance, they have to do nothing. We do all the heavy lifting. We call their healthcare providers, and we request the medical records and everything we need to confirm that they do indeed qualify for their CGM. And once they qualify completely and that process has been completed, then we send them a starter pack, which includes the sensors, and it includes the monitor, which they can use. They can also use the mobile app. And directly to their doorstep. So this is so much easier because they don't have to go into the pharmacies in person and pick up their prescription every single month because we do it for them.
Right. So the sensor is the wheel. You put the sensor on your arm, and then you also supply the little monitor, which looks like sort of a phone, and it gives you the information. But on your phone, your normal phone, whichever one you have, whether it's, a Samsung or an iPhone, there's a little app, and then it coordinates with your sensor, this little wheel, and then within half an hour you start getting the data. Is that correct?
Yes, that's correct. And it pings you with alerts whenever your levels are too high or too low. It's extremely beneficial, especially for anyone with a cell phone, like you said, Android or an iPhone. We also, at Lincoln Health Supply, we've developed a mobile app that is user friendly so that our patients who are being supplied by us, they are able to get any, or they're able to track any updates that are made to their shipments so that we have made it extremely transparent and convenient during that process of managing their diabetes.
Yeah. I mean, one of the things that I love about this new system, because again, when my dad was doing it, I would see these needles that were like this big. And now the way everything works is that it's a very small, thin needle that is painless. You really don't feel that needle when you're dealing with the sensor, and it takes a lot of the intimidation out of it, because when I first did it, I was scared. I was super scared. I was like, oh man, I don't know that I could do this. And I'm not the kind of guy who looks away when they're injecting you. I have to look at it because otherwise, my mind is very powerful and I create these ideas. So I'd rather see it, and doing it myself, it was really one of the most streamlined, simple processes that I've ever done. And it took all that anxiety and everything out of it. And then you just get used to it, and it's very, very acceptable. It all works together very seamlessly. And looking at the phone was great because obviously everyone has a mobile phone. You just pick it up and it says your blood level is this, and
Right.
you can coordinate your day. If it's low, then you can exercise. If it's high,
Exactly.
you can do some other things. Make sure your diet is in check so that it doesn't contribute to higher numbers. Is that right?
Absolutely, absolutely. This sensor makes it so much easier for anyone with diabetes to be empowered to regulate their diet and exercise a little bit more so that it does help their levels. And and yes, the needle, as you said, it's very small, maybe half of an inch, and it's to those who are intimidated by needles or who fear them. They don't have to fear this. It's extremely painless and it's seamless. As soon as you stick the sensor on the back of your arm, or wherever you prefer, then you will be able to track your blood sugar in very little time, and you can say no to finger pricks.
Exactly. I love that idea because I never want to do that again. I mean, I got that machine. I used it twice. I never used it again.
I do not blame you.
No, it's scary. So one of the things that I'm very curious about is your engagement with people who have diabetes, because it's not just you fill out the form and then you start getting this. I mean, there's customer support, there's all these things that help people like me who might have a question, like if there's an irritation or something that might occur, which is very infrequent. I've been using it for a long time, and I only had one time that I had an incident with the glue, and otherwise it's been perfect. So how do you engage with your clients, with the patients?
Well, first of all, our patient care team, which is essentially customer service, they do an incredible job of handling all of our patient orders and answering any questions that our patients may have. And we've become very involved in the community. Last year, we sponsored the American Diabetes Association Step Out Walk, which is really fun. We are fundraising for more awareness for diabetes research. We also partnered with Nova Southeastern University for a diabetes prevention and management webinar, and we most recently held a blood drive with one blood. So these outreach events really allow us to spread more awareness for diabetes and help them manage it more effectively.
I think that's super important because what I see on YouTube specifically is videos from people with diabetes who explain things about the products and the machines, and they give you advice and tips and everything. But to have a hometown company that's available, that's nearby, that you trust, you develop a relationship, and then that can help you tap into a community of local people, right?
Correct.
And you can participate in these walks and other things. And that helps in, again, alleviating anxiety around these products and the necessity, right?
Right.
And I know that there's been a lot of attention on drugs that can impact weight related to diabetes and everything. But the most important thing to understand is even if you're taking any of that, you still need these monitors because that's the only way that you can make sure that everything is working the way it's supposed to.
Right.
Yeah.
Exactly. Yeah, these CGMs, they really do. I mean, we see it firsthand. We are speaking to our patients every single day. They call us, and I give them my email and my cell if they need, because it can be extremely like a huge nuisance, and we don't want that because living with diabetes is already so difficult as it is. And if we can help make the process more streamlined and painless, then we are absolutely here to do it.
Yeah. I think the thing that most people don't realize is that it is a nuisance. It's difficult to manage your day around injections if you're injecting insulin. If the great thing about the products that are out now is that the pens for insulin and other related drugs are very easy to administer. And again, a very small needle. So the first step is to be able to have a conversation with Lincoln and then have these products available and understand why they're important. Is that right?
Exactly. And also living with diabetes can be extremely, no, not can be, it is extremely expensive, especially for those who have to pay out of pocket for these devices. And we really want, at Lincoln Health Supply, we really want our patients to be able to have that coverage with their insurance companies. obviously we don't have much control over whether they have coverage or not for these devices, but in the case that they do, then we will absolutely send them their sensors every single month, and it's a recurrent shipment and directly to their doorstep. I mean, who would want to say no to that?
Right.
And if if let's say they have Medicare, and that would cover up to 80%, and if they have any secondary insurance, that would also cover up to 20%. But we also do take a lot of other insurances for those who are interested in getting their CGMs today.
That's great. Now, just to be 100% clear, you are not a doctor. The company is not a doctor. What you're supplying is the products. So there's still a primary necessity to engage with your doctor and make sure everything makes sense. The difference is that instead of getting it through a pharmacy, instead of having them prescribe it and send it to whatever pharmacy you normally go to, you're dealing with Lincoln and they're providing you with this product.
Correct.
Yeah.
We are not a replacement of your healthcare provider. We are simply the ones who provide these devices, and it's still a requirement that these diabetics will have to go to their doctors every so often to make sure that they are on track and their health is still on track. And one thing that I do want to point out is that for speaking in about insurance, if there are many who might have been denied coverage for their continuous glucose monitors in the past, and they may not know that they qualify today. So it's extremely important, and we're just a call or email or a survey away. And I really do recommend this easier lifestyle for living with diabetes and managing it properly.
That's great. The key is managing it properly. And I think that Lauren has given us a great perspective on everything that can be done to help people like me make their quality of life better. And I know that it makes me happy, particularly because one of my pharmacies recently changed their hours, made it that they closed earlier. And that creates some challenges because a working person has to go to work every day, and traffic is crazy in Miami. And especially with everything that's going on, we're in spring break right now. Ultra is downtown. After Ultra, there's another thing and another thing and another thing. Can't always make it to the pharmacy exactly on time. So this is a great option that I think will offer more people who aren't aware of the products and customer service. This will make their lives better. So I want to thank you for coming to the show today. And I want to thank Lauren for being such a wonderful guest. And I'm looking forward to next time when we have more information about how great business in Miami is. Have a great rest of the week.
Thank you.